Hello there. You have an appointment with us. Amazing. Let me just turn that page, okay? So what time is your appointment? 5:20. Yes. And that's with the doctor. Alright, amazing. Just put that there. Okay. So you are probably aware of our whole entire procedure of before we have the appointment. We still have to fill out the forms. We have to just go through your medical history and update any other information that might have changed from the last time we saw you. Yes, yeah, even in the cases of regular checkup / a concern for the appointment, the reason, yes. So no worries. I'm gonna get the forms, okay? And you are a little bit early because the appointment is 5:20. It's 4:55, so we have a little bit more time. So we can really calmly do it, okay? So no rush and no worries, okay? Is that okay with you if we go through? Yeah. So I'm Olivia and I'm gonna be your nurse today. And after you fill up the forms, I'm gonna just get your vitals and just check your general health, if that's okay. Just before the doctor's appointment, so then he has this information. Plus, he will also be doing that as to see two different perspectives. Yeah. Okay, amazing. Okay. So this is gonna be medical history, as this is called the part 1 in the forms. So everything is of course confidential, so don't worry about that. And this is just your personal information, okay? So can I have your full name, please? Okay. Thank you. Okay. Can I have your date of birth? Yeah. And just to ask, we have all the information in the system, but this is just allowing us to do it on paper to then update it in the system. So this is just confirming and checking. Yeah, so can I have, is your address still the same? Okay. Okay. Sure. You can tell, yeah. Amazing. Thank you. And can I have your telephone number? Dear. 167. 167. Okay. I'm free. 389. 389. The last digits. Yeah. Amazing. Thank you so much. And your emergency contact. A phone number or email, that depends. Okay, great. Thank you. Amazing. And can I have the full name of the person? Okay, great. And just to this is from the new forms whenever we have a new patient, and it's just registering point, but do you have the family doctor? If you're so if you have or ever had a family doctor, we can also contact the doctor and then we can get the history for that. Yes. Okay, amazing. Thank you. Okay, great. So today's doctor name, phone of the doctor, and the surgery that you are at. Okay. And this is for health reasons. Can I have your occupation, please? Thank you. And have you had any of these symptoms which are in the last 7 days? Which are headache, or any redness or rash, any fatigue, any swelling, any fever, or any other symptoms that are unusual with you? Okay, no problem. So you tend to have migraines then? Okay, so it is a little forward, again a little bit on the back sometimes. Okay, that's completely, I'll write that down, it's very important, thank you. Sometimes we do get a headache for different reasons, yes. I understand, yes. And are there any allergies? Yes, just list all of them. Even if we have them on the system, it's just gonna go through as the same. Yes. Okay. Thank you. And then this is a little bit about your family history plus your own family history. So if you or anyone in your family is suffering or have suffered from any of the following conditions, just say yes, and please provide the medication or any form of relief that they have. Yes. Okay, so is there any the conditions that basically are, I'm gonna tell them, so any heart diseases, okay, stroke, cancer, epilepsy, asthma, okay, diabetes, high blood pressure, okay, and any high cholesterol, okay, and if there's any other illnesses, okay. Okay, amazing. And are you currently on any medicine? Okay. And how much? Like, what's the intake? Okay. Between, yes, absolutely. Is that prescribed medicine? Okay. Okay, great, thank you. And this question can vary. So, are you aware of what your triggers are? So basically, if there's anything like headache, like you said yourself, sometimes you get headache whenever you didn't get enough sleep, or you know your body is basically telling that you need to rest, or you need to drink water, or anything like that. So do you know what sometimes triggers your health, or are there anything, is there anything that is worrying because nothing changes in your diet or in your surroundings, even emotionally, and something happens and like makes you feel different, if that makes sense? Is there anything, would you say it's normal for you? Okay, I can put that down, that's okay. Thank you. Okay, thank you. Now we're gonna move to the form that's one of the most important as well, because it's usually there are many reasons basically that doctors find something, so it's basically a lifestyle. But before, I just want to ask if there's like, what's the main reason for your visit today? You have, yes, okay. So you have, okay, booked. I understand. Yes. And how long has this been going on for? Okay. No, it's important to get checkups, but it's important to also go to the doctors if anything is happening, okay? Don't wait until it's really, really bad. It's never good, okay? You did very well, yes. So yes, this can be improved by antibiotics, yeah. So okay, I can put that down. So you did have that before. Did you use the antibiotics? Okay. It's okay. Yeah. Antibiotics can relieve the symptoms from my experience, but of course we will get the doctor to check that with you, okay? And also, yes, the doctor is, yeah, I'm gonna, so would you like me to change that? Okay. Change this. Amazing, thank you. Okay, like you said, yes, if the pain radiates, then it's very important to mention that, okay? So I did put that down, but you can also mention to the doctor. Yes. Okay. We will have a look at that as well, okay? Now to the lifestyle questions. The first one is, do you smoke? Okay. And how many cigarettes per day? Okay. Do you, and if yes, how often do you exercise? Okay. Do you drink alcohol? How many units a week would that roughly be? Okay. 2, 3? Depends, yes. That's okay. Thank you. And how is your sleep? How many hours per night would you say you get to sleep? The reason for it, yeah, absolutely. Do you nap throughout the day? Do you get like 15 minutes nap or 30 an hour, or do you not sleep at all until night? Okay. And with that, if I could just ask, what time do you roughly usually get up? Okay, if you have to. So you get, okay. And if it's like a day off, okay. Yes, that would make sense. Okay. So that's done. Get some of them done. And now we will move on to the infections, vaccinations, and diseases. Okay, that's what's the another code to call. Okay, so let me just grab the book of today's patients, and let me just have a quick look at your medical history, and I will see about the vaccination. Okay. Did say you're up to date, yeah. Okay. So the last vaccine, okay, you had, okay, and that was for, yeah. Okay, amazing. Yeah, so you're up to date, so no worries with that. Your health chart looks okay with what we've been through so far. No changes, some, but no major. No any other conditions that would put your life at risk at the moment. So, okay. So Have you had any infections in the past 12 months that caused any permanent changes? That would count, yes. If you lost smell, yeah, absolutely. And how long ago that was? Yeah. Okay, so that was alright. Amazing. So I will be scheduling an extra test for that, and one of them will be blood test, just to confirm that we clear of that. Okay. Okay. Yes. So the blood test will be done with the doctor, not right now, but either the doctor will make the final decision. So they either gonna do it now, and then the should be done. Okay. All right. So your overall health seems to be stable throughout your chart. I don't really have any concerns, but I will be running a few checks, okay, which are vital signs. We're gonna be checking that. It's like a little small physical exam, like I said, that we will be doing, and then the doctor will also be repeating that. All right, so let me put this over here. And I'm gonna put some Hansha. And now I'm gonna put my glass on. We're gonna be checking your temperature, your blood pressure, your heart, and respiratory rate. Okay, those are the first three. Only this glass, the glass would put. Okay. All right. Have you had the allergy? Because it might be related. So did you get the allergy test before? Did you have that done in a different clinic? Okay, that's completely fine. We should have that. Yeah, amazing. Okay, so do we have the gloves on finally? So I'm gonna begin with checking your temperature. Okay, so I'm gonna put this under your tongue. Okay. Just wait. Okay, so just. And hold it, yeah, sure. I'm gonna hold it. Okay, let me see. Okay. Alright. It looks a very good temperature. And I'm gonna get your blood pressure. Okay. So I'm gonna put it right here. Okay. Do you have an arm preference? do you tend to have a little bit higher? Yeah, perfect. So it varies. So sometimes it's very low, sometimes it's very high. Okay. We will see that jump. Okay. Yes. Thank you. Alright. Put that back. Move this over here. Okay. So we're going to be measuring your heart and respiratory, okay? Right. So I'm going to put my stethoscope in. And if I could just have your hand down, yes. If you could just lay it on my hand, okay? Alright, just relax. Okay. Alright. Okay. And I'm just gonna put that in. Let me do that. I'm just gonna put that in your ear, and this way we're gonna be doing it, measuring it by temperature. And I'm gonna put this in your ear, okay? Alright. So let me just put this back on. Okay. Okay. Alright, yes, if you could hold it, thank you. And I'm gonna grab that. Okay. And please lay your hand still. And just relax, okay? Alright, let me put this up. Alright. Yeah. Thank you. Okay. I'll put that back over there. Now it's just as if you could maybe come closer a little bit to me, and I'm just gonna check your heart, okay? And your lungs. Okay. Thank you. Okay. Okay. So I'm just gonna do that. Just breathe normally. Okay. And now please take a deep breath for me. Hold it. And breathe out. Good. Hold. Breathe out. Good. And one more time. Breathe in. Hold. And exhale. Okay. Let me just check your back, okay? Breathe one more time. And breathe out. Good. Okay. So you have a very healthy heart. I don't hear any worrisome sounds. So this should be, I'm just gonna double check, but write that down. So now, so your temperature was, and your heart is very, it's a good. So now I'll be inspecting your face, okay? So what I'll be doing is just looking for anything that might seem like a swelling or that might just be out of order. And I'm going to be palpating your face to double check. No, don't worry. Okay? Can I do that, yeah? Can I touch you, yeah? Okay, great. So I'm going to start on top of your head, actually. Okay. So top of your scalp. Okay, now I'm going to check your lymph nodes, okay? Just to make sure. If you could swallow for me. Okay, that's good. Okay. Alright, perfect. So your pulse and reflexes. So your pulse seems to be good too, but now I'm just gonna try to do your reflexes. So I'm gonna like also palpate just to check, okay? Don't be scared. Okay. You have no swelling, right? Alright. But yes. Okay. And I'm gonna measure your face. Just certain points. So I'm actually gonna grab my pen for that. This is gonna like leave little dots and I'm just gonna measure from that point, okay? Can I do that, yeah? Amazing. That's where I check. Okay. Do that. So yes, if there was any swelling that it's just not noticeable to the eye, we will find it with the measuring as we can tell then what's normal and what's just the too much. Yeah. Face is pretty symmetrical. Let me just tell you that, because yeah. So one thing that worries me is the abdomen pain that you were talking about. So I will be scheduling the blood test as I mentioned, and I will be also doing the check of abdomen. So the doctor will also decide on the X-ray. But we for sure will get the abdomen checked and the blood test. Okay. So I'm gonna just take a little note. Doctor, let's see. I will be writing a little note for him. Okay, so we have the abdomen test. For sure. And then we have the blood test. And then I'm going to put the X-ray in brackets. Okay? Here. So you're just going to get that little note to the doctor when on your visit on your way, okay? Amazing. I'll put it here because we might still need to write something. Alright. Is done. The results then should come within 20 to 36 hours. So if there will be anything that shows up, comes out, and anything that might be worrying you, we will contact you straight away. Okay? Probably myself. Amazing. And now we have a couple tests, just last things to do before your appointment. Finally, we will be checking your sensory organs. So this will determine and help us determine really if your ability to perceive and respond to your surroundings. So I will need first of all. Okay, so I'm just gonna put that torch, okay? A little light. Okay, so just look straight at my nose. Yeah. Okay. Just look at my nose. Look at my nose. Okay, if you could look up, 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 up. Okay. And now look down, 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 down. Just could you hold your head still, okay, and just look down. if you could just move your eyes to your right and do that, and to your left. Okay, and now back, look at me. Okay, amazing. Thank you. I'm just going to be doing this test with you, which is not really a test, just check up. So I have my fingers, okay? So whenever it goes, just look at this hand, okay? Don't follow this hand, look at this hand, just this one, okay? Your right, my left. Alright. Okay? So. Okay, now I'm gonna move my fingers, and now you have to just tell me which hand I'm moving, okay? Great, okay. Good. Yeah. Good. Good. Yeah, good. None? Yeah. Good. Okay, good. Responsive, reactive. Alright. Okay, good. Now I'm going to take my little torch again. I'm gonna ask you to just go, ah, okay. Just gonna check your throat. Okay. Just 1 second. Okay. So just have a better look with this, okay? Okay, good. Yeah. Yep, sorry. Okay. Good. Yeah, just one more time for me. Okay, perfect. Thank you. Okay. I'm gonna be checking your sense of smell and of taste, not smell. So I'm just gonna put. I have three little solutions. Okay. And I'm just gonna put a drop of them. I'm gonna put a drop of them on your tongue, okay? Okay. Okay. Great. Yeah? What did this taste like? Good. Yes. Alright, cinnamon. Yeah. Now we're gonna get another one. they're not strong at all. It would seem that, but they are mixed in a special solution. So, yeah, okay. Yeah. Mint, very well. Very good. Yes, this one was the hardest one yet. Put that back here. Alright, so it's intact as well. Perfect. And to ask about your dental care, how often do you go to the dentist? Okay. Have you ever had any procedure done for your teeth? Mm-hmm. Okay. Okay, amazing. So now I will be looking in your ears so you can just turn to the side. Yeah, thank you. Or, yeah, that's perfect. Okay, very good. And then outside. Yeah. Okay, beautiful. How do you clean your ears? Perfect. Yes. Okay, so let's just meditate that. And now I'm gonna have a sound for you, and you're just gonna tell me what intensity it is and how long you can hear it for. Okay, so just straight look at me. Yeah, and please close your eyes. Yeah, it's just I figured out it helps. Yeah, amazing. Okay. Now we're gonna be doing a reaction time test, which is sort of you have to copy what I'm doing. Okay. So we're gonna focus on my hands. So whatever I do with my hands, you have to do. Okay. Amazing. Okay. Okay. Great. Amazing. And we will like that. And now just tell me, close your eyes please, and tell me if you can feel the strong air or it's light, okay? Yeah. Okay, great. Amazing. And one last one for touch and sensation of touch would be except this brush. So this, okay, be soft, okay, soft, and this, not this, sorry. And this sharp, okay. So you have soft, sharp, okay. So please close your eyes and just tell me which one you feel, okay? Mm-hmm. Uh-huh. Mm-hmm. Yeah. Beautiful. Amazing. For the last test, which will be checking your sense of smell, I'm gonna give you a little marker tube that we have. Okay. So please tell me, what smell is this? Okay, great. This smell. Yep. Could you tell me this smell? Mm-hmm. Good. This one? Mm-hmm. And the last one. Amazing. So now I'm going to have to compare again. And now that you know how they smell, we had 6, but now you have 5, okay? So one is missing. Could you tell me? Could you tell me which spot is this? Very good. Could you tell me this? Perfect. Could you tell me this? Yes. Could you tell me which is? Oh, yes. Last one. So which one was missing? Do you remember? Banana. Yes, bananas. Alright. Yeah, double check. Let's double check if we have all the forms done. Yeah, sometimes it is difficult to smell things, especially when your nose is stuffy. Yes, it's because the cells, the receptor cells inside of your nose, tend to get covered. Sorry about that. Get covered, and the sensation that's being transmitted into the brain to basically acknowledge the smell just doesn't have a clear pathway. So but your senses, good exercise I would say is with breathing, just letting breathe through your nose, but I know it's exhausting at times, and yes. Okay, so that's done. I'm just gonna ask you. Okay, so after your appointment with your doctor, you will just come back here, okay? And I'm gonna make you the follow-up appointment for the next visit. If you have any questions right now, go ahead, ask me. If you have any concerns, worries, or if you're uneasy about anything, you can tell me right now, and I'm gonna add it to the message for the doctor. Otherwise, we pretty much done. I'm just gonna need you to sign over here, okay? Get you pen. Okay. So we will figure it out. I could add that to. Yes, thank you. Okay. So let me just get the note for you. Alright. And just add that as I am also would like, yeah. Doctors love questions, don't worry. Okay, so I'm just gonna do that. Okay. I'm gonna give me a signature and today's date. Alright, there you go, here's your note. Thank you. Have a nice visit. Have a nice appointment with the doctor, and I'll see you right after, okay? Amazing. Nothing to worry about from me. Very happy with your health overall. So it's nice to see you again, okay? And I see you again in a second, so that's great. Amazing. See you soon. Thank you. Bye bye.